Welcome back to the show this morning at 6:47 as we get the Real Investment Show underway. You know, one of the big topics that we discuss and have talked about on this show in particular, through all the variations of this show going back, 5 years from, the Lance Roberts Show, the Real Investment Show, back and forth, has been healthcare. And one of those issues that we've talked about when the Affordable Care Act was being put together, Brent and I interviewed numerous individuals, doctors and patient care people and politicians and insurers. I mean, you name it. We probably interviewed somebody from some aspect of the industry to talk about the problems of healthcare. Why is it so costly in the U.S.? And, is this and why the Affordable Care Act was only going to wind up making things more expensive, which is what turned out to be the case. What's important to understand is that we all want cheaper healthcare. There's no doubt about that, right? Healthcare is just freaking expensive. We pay our insurance premiums every year. We personally run a high deductible plan, so we've got a lot of out-of-pocket costs up front before the insurance kicks in, but it lowers our premiums. But we all want cheaper healthcare, but we also want high-quality healthcare, right? And, this is the problem with the American population in general, which is that we always want the best that we can get for the cheapest that we can get it. What we forget is that the more layers of individuals that you insert between the patient and the doctor, or in any environment, right, no matter what it is, if you want cheaper cost, you've got to cut out all the people in the middle between the user and the end product or service, whatever it is. If we take a look at, a lot of different activities that we have in the world today, here's a good example, right? Food delivery. If I want the cheapest level of food, I go directly to the fast food place, right? I get up out of my house, I drive over to Taco Cabana or whatever it is, McDonald's, buy my food, and then drive back and deliver it myself. If I want convenience and I insert Uber Eats or Grubhub in between, I now have to pay a tip and a delivery service, which adds to the cost of my food, right? So our food costs go up and we're going, wow, we're spending a lot more on food, but it's because we've inserted somebody in the middle of that transaction. If you want to lower the cost of that transaction, remove the people in the middle. When we decided, instead of going to doctors and saying, Dr. Jones, I'm here, I'm sick, he treats you and you pay the doctor directly, instead of saying, hey, you know what, I'm going to pay the doctor for my maintenance and my upkeep, right? If I get the sniffles, if I get, a little cold, I get the flu bug, whatever it is, I'm going to go to the doctor. He's going to treat me. He's going to bill me directly. I'm going to pay him. That would keep your costs down. But we didn't want that. We all wanted $25 copays. We want, free access to doctors. We want all this stuff. So we said, hey, let's have insurance. Let's put together this insurance product that we can pay for. And then if we get sick, we're now going to have this cheaper cost to go to all these doctors. Well, you inserted somebody in the middle of that program. Those people have to be paid. They've got to run a business. They've got to make a profit. They've got to do what they're doing. So we've now inserted somebody in between the doctor and the patient. And then we went along and said, well, we don't like that. We want to insert the government in between this process too. So now you've got, between the doctor and the patient, you've now got the insurance company, you now have the government, you now have the exchange, the healthcare exchange between you and the doctor. Well, all those people have to make money. And so we wonder why the cost of healthcare has gotten so expensive. Here's a recent story from Reuters. U.S. insurers and providers spent more than $800 billion in 2017. That's the latest data. On what? What did they spend $800 billion on in 2017? Administration. It's about $2,500 per person. Just what they spent on administration. It's 4 times the per capita of administrative costs in other countries. Of course, we have also, and also you got to really kind of keep this in mind too, is that we have a lot more people here. Comparing the United States to Angola is not a fair comparison, right? You take country, a lot of people talk about wealth inequality, and it's like, well, you take a look at a country like Denmark, they're per capita wealth is a lot better, not high. They got like 6 million people versus 330 million, right? It's functions of numbers. But over a third of all the healthcare costs in the United States are due to insurance company overhead and provider time spent on what? Billing. Medical billing has always been one of the biggest problems of the healthcare provider service. Again, once that we stuck the insurance company in between the doctor and the patient. You know, one of the things that we talked about numerous times on the show when the Affordable Care Act was trying to be put in place, and we're going to reform the whole healthcare system with the Affordable Care Act, we said, look, the healthcare system is not broken, right? The healthcare providers want to provide healthcare. The doctors want to take care of patients. Patients want to be taken care of. That system is not broken. There's a few things that need to be fixed. Medical billing was one of those. Medical billing, tort reform, because everybody goes, well, I don't like my doctor, I'm going to sue him. So medical malpractice was, you know, outside of you know, reality in terms of what doctors pay for that. But that, you know, if doctors have to pay a tremendous amount for their malpractice insurance because every yahoo on the street that doesn't get exactly the care they want wants to sue, well, that cost has to be passed on to who? You. So tort reform needed to be fixed. Medical billing practices needed to be fixed. Prescription drugs needed to be fixed, right? There's a few things that needed to be fixed in the system, but we decided that the better solution was to overhaul the entire system and stick the government in the middle of it, because that was going to solve the problem. And as we predicted from the first day that that was going to be the case, we said all this is going to wind up doing is lowering the cost lowering the quality of healthcare and increasing the cost, which is exactly what happened. Those 20 million people that we were supposed to cover, still uncovered. Actually, there's more of them now. They can't afford the insurance. And this is because you stuck the government in the middle of it. And so now we have these Democrats that are running for office wanting to provide more of the same. There was a quick byline here. Over the weekend, Elizabeth Warren was confronted by a man who had worked 2 jobs to pay for his daughter's college so that his daughter would graduate college without any debt. And he goes, so Elizabeth Warren's up on her stand and she's, you know, talking about free health care for all. She's going to, you know, work to forgive debt for 90% of student loan borrowers. And he says, well, what about me? Do I get my money back? Because I paid for my daughter's college. I worked 2 jobs to pay for my daughter's college. Do I get my money back? Elizabeth Warren says, no, of course not, you don't. And see, this is the problem. You know, with all these plans, we want to use government taxpayer dollars to fund other things, which when you stick the government in the middle of anything, there's only 2 things that are going to happen. Cost is going to go up, quality is going to go down. That's it. And this is seen, there's not one government program ever in the history of the United States where the government got involved and things got better. Education, good example. 1980, we launch out the Department of Education. At that time, America ranked number 2 and number 3 in terms of math and science. Today, we're like 27 and 30 since the government got involved in the middle of it. Teachers no longer teach, they teach test. There's not one aspect of our lives that are better once government intervenes in between the patient and the service and the user. Costs go up, quality goes down. And so this is the one thing that we continue to make the mistake of, is thinking that government is going to fix our problems rather than addressing the problems ourselves and working directly with the individuals that we deal with. We want government to fix it. And, you know, we use plastic surgery as an example of this because it's an easy comparison to healthcare. Plastic surgery is pretty much something you pay for out of pocket, right? You want facelifts, augmentations, whatever it is. You go to the plastic surgeon and you say, hey, I want this fixed. They say, no, great, no problem. The majority of the time that is out of pocket. Now, there are certain things that are covered plastic surgery wise. It gets covered under insurance, you know, but majority of the time it's out of pocket cost. Now, what's happened with plastic surgery over the course of the last decade? Quality is tremendously better. Cost has dropped dramatically. Why? Competition. Competition between plastic surgeons that want services, right? So I want customers, I've got to provide a top quality service, and I've got to compete on price. And so Whenever that happens, whenever you put competition in the middle of a user and product service, cost is going to go down, quality is going to go up. And that's just a function of economics, because that's the way economics actually works. We've got to stop depending on government to try to solve our problems, because they can't do it. They don't have the ability to do it. They don't have the capability to do it. But once you insert government, why is college so expensive? Because we stuck government in the middle of it. Once government took over student loan debt surged, has gone up by $1 trillion. College costs have surged. Why? Because the government's giving away free money. So if the government's giving away free money, why would I not raise my tuition? Everybody else is raising their tuition. Government funds it. I'm going to raise mine too. It's how market environments work. But the point is that if we want better quality, and we want better quality with cheaper costs, remove government from the middle of the transaction, and that's what you'll wind up getting. Be responsible for what you do. Pay for it directly. You're going to get cheaper costs. Healthcare insurance should be catastrophic only. You pay for out of pocket for sniffles and flus and colds. You get really sick. That's what your insurance is for. You do that, insurance costs come down, quality healthcare goes up. It's a pretty simple formula. That wraps up the show for the day. And of course, get by our website today. We have a new report out talking about, well, retirees should worry about bear markets and market crashes because it has a major impact on the ability to retire. That article out on our website now, realinvestmentadvice.com. Get by the website, realinvestmentadvice.com, and we'll see you tomorrow on the next edition of The Real Investment Show. Have a great day.